Good evening, everyone. My name is Richard Russell, and I am honored to serve as the Executive Director of Healthy Community Brookfield. For the past several months, with the assistance of various staff members, I have been conducting a situational analysis of the organization. This analysis has allowed me to assess the current state of the organization to propose a strategic plan. This evening, I will share with you the results of this analysis and my recommendations for the organization to move forward in serving the Brookfield community. Healthy Community Brookfield originated as a department of the county's visiting nurse agency and was referred to as Brookfield Health. Brookfield Health had a very modest operating budget of $112,000 and managed state contracts for cardiovascular and school-based health initiatives in the county. This agency was led by a program director, Elaine Caulfield, and employed 3 part-time employees. Later in 1998, Healthy Community Brookfield would become a freestanding agency to promote health and wellness activities after a $2 million donation. Ms. Caulfield became the executive director of the agency and appointed staff from the visiting nurse agency to director positions at HCB. Today, the organization remains a freestanding agency serving Brookfield County. The vision of HCB is that the promotion of healthy practice leads to improved health behaviors and healthier communities. The current mission of HCB is that the organization strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices. The values of Healthy Community Brookfield are that we value honesty and integrity in the services we deliver to the community. We value high-quality services and connectedness with other community partners. We value our staff and their well-being. And lastly, we value being a public health leader in the community. External and internal feedback on the vision and mission of the organization was received and will be discussed in more detail later on. Today, Healthy Community Brookfield serves a population of 85,000. Services are provided by a staff of 97 employees, ranging from medical staff to enabling services staff such as program managers and community health workers, clerical staff, and administrative leadership. When Healthy Brookfield was first established in 1998, the strategic plan of the organization focused on the provision of medical and nursing services. Most recently, the strategic plan focused on seeking grants to support specific programs. Healthy Brookfield Community provides a myriad of medical and program support services to promote a healthier community. Medical services include primary medical services, women's health and prenatal services, newborn services, vaccines, and mobile health services. In addition to these medical services, HCB provides supportive programs such as case management services for the elderly who have been discharged from the hospital, after-school teen programs, violence prevention programs, well water testing and water mitigation assistance, and an array of wellness and fitness programming. The majority, if not all, of these supportive programs are tied to either grants or contracts with the county. With the assistance of the Human Resources Director, an electronic employee engagement and cultural assessment was distributed to all 97 employees. The survey was voluntary and responses were anonymous. We received 68 responses from employees who ranked their experience at HCB in the areas of quality and productivity, leadership and management, and communication. These experiences were ranked using a 5-level Likert scale. Overall, the results of the survey were positive. The average overall score was 3.77 out of 5, and there were strengths identified in each of the 3 categories. Some of the highlights are that employees are proud to work for the organization with an average rating of 4.9 out of 5. Many employees report feeling that the organization has a history of successfully providing effective public health services and that they know what occurs in the organization in real time. Another area of strength identified in the survey is the employee staffing structure and relationships amongst staff members. Employees feel that HCB employs an appropriate number of managers and feel that management seeks input from their employees and treats them fairly and with respect. When asked to rate the friendliness between employees, the average rating was 4.8 out of 5. Lastly, for those who reported feeling respected by their managers, the average rating was 4.6 out of 5. Employees also identified areas of improvement. A common theme and weakness is lack of clarity in the mission and direction of the organization. The results confirmed that employees feel that the mission and vision of the organization are unclear and that there is a lack of alignment between the mission and the programs offered by the organization, with the average employee response of 1.9. The survey results also suggest that employees are not feeling valued, with low average ratings in employee recognition based on outcomes, and feeling that organization cares about that the organization does not care about the long-term welfare of employees, with an average rating of 1.7. While many employees feel that they know what is happening in the organization, employees feel that HCB could improve on better communication with the community on organizational plans. Healthy Community Brookfield has had a rocky financial history, quickly depleting the original donation of $2 million in only 8 years. While the hiring of a chief financial officer and grant writer has alleviated the financial concerns, it has not eliminated them. Upon the hiring of the CFO and grant writer in 2008, HCB implemented a strategic plan to apply for grants to fund specific programs. HCB also approached the county to allocate funds for services. This has allowed Healthy Community Brookfield to provide a variety of services and programs. However, there is no sustainability plan to continue the programs once the grant funds or county contracts come to an end. Without a plan, the loss of grants and contracts would not only cause elimination of the programs and services that rely on this funding, but it could potentially lead to the loss of jobs for program staff. This concern for job stability due to funding has been expressed by program personnel, who often worry about their job stability and feel that medical personnel is more valued than they are. Lastly, at this time, after failing to meet accreditation standards by the Public Health Board, the county is at risk for losing contracts. External factors play an important role in the success of any organization, including HCB. Communities are comprised of different parts, with each part serving a purpose to assist in meeting the needs of the community as a whole. Improving the health status of the county will require participation of members to seek services and organizations to provide the services as appropriate to their specialty. If each part of the community is not fulfilling its role to meet the overall goal, then the community as a whole is not as strong as it has the potential to be. To effectively deliver health and wellness services to the Brookfield County community, it is necessary for Healthy Brookfield community to engage community members and key stakeholders in the initiative. At this time, HCB is viewed as doing good. However, community members are confused on services provided by the organization. Frustrations have also been expressed by community groups. County officials are frustrated with the persistent demands for funding, and other local agencies are frustrated by duplication of services. After assessing the current state of partnerships and community engagement, it is evident that Healthy Brookfield community has weakening but salvageable relationships with organizations of the community. A SWOT analysis was conducted to examine the current internal strengths and weaknesses, as well as external opportunities and threats that Healthy Community Brookfield is currently facing. First, let's explore the internal strengths. One of the strengths of the organization is its reputation both with employees and the community. Employees view Healthy Community Brookfield as a good place to work. This is supported by an employee culture and engagement survey that was recently conducted and demonstrated an average rating of 3.7 out of 5. This satisfaction is noticeable by the community members, with the board and staff of Healthy Community Brookfield being viewed as hardworking and dedicated. The general satisfaction of employees is imperative to the success of the organization. Satisfied employees are more likely to be engaged, leading them to maximize efforts in providing quality services. On the team of satisfied employees is a motivated and highly skilled chief financial officer, grant writer, and program officer. These members are able to ensure the mission is met by identifying and securing funding sources, as well as directing program services to create a healthier community. Another strength of the organization is that it is providing a myriad of health and wellness programs and medical services that align with the overall mission of promoting a healthy community in Brookfield County. These strengths should be sustained and improved upon. Like all organizations, Healthy Community Brookfield is facing weaknesses that pose challenge to the success of the organization. The biggest internal weakness of the organization is a lack of a clear vision and mission. As reported by the survey, employees are unsure what the mission of the organization is, which is only perpetuated by the board members and senior management seeking grant funds, whether the programs align with the mission or not. While employees are generally satisfied working here, a lack of clear mission and vision will hinder employees and engagement in the long run. Employees may also feel frustrated by adding programs and duties that are sought only for funding purposes. Another area of internal weakness of the organization is a lack of a sustainability plan for programs. The lack of a plan results not only in a loss of programs when funds run out, but also a worry of job instability. Program employees are worrying about the future of their jobs and feel underappreciated. Worried employees will eventually become less engaged if they have not already, resulting in lower job performance and lesser quality of services delivered to the community. Fortunately, Healthy Community Brookfield has a variety of opportunities through potential partnerships with other local organizations. One of the biggest external strengths are the opportunities for funding and collaboration. Because the County Health Department has limited resources, HCB receives state and county contracts to provide public health services to the community. This is a current strength that must be sustained and further built upon for financial security and sustainability for programs. There is also opportunity to collaborate with local agencies that provide services HCB also provides, but is currently at risk of losing funding for. Additionally, there is a strong network of social service organizations such as the YMCA, Meals on Wheels, and United Way, which HCB would benefit from building partnerships with. These agencies provide services that help create a healthier community by addressing social determinants of health, which HCB is not capable of addressing alone. Lastly, past and current program offerings are dictated by perceived needs of the staff. There is a great opportunity to engage community members and stakeholders by conducting a need assessment and/or conducting focus groups to allow the community to identify their actual needs. The major external threat the organization is facing is the uncertainty of the organization's intentions. This uncertainty stems from a mission that is unclear to key stakeholders of the community, frustration from organizations that feel HCB is duplicating services that they were already providing, and hesitance from target populations such as local farmers who feel that the water mitigation programs that we are promoting are unaffordable. It is imperative that the uncertainty be addressed. If community members question the intention of Healthy Community Brookfield, they are less likely to engage and receive services, and they are less likely to view this organization as reputable and respectable. Lastly, another threat that the organization is facing is a possible loss of funding due to lack of accreditation through the Public Health Board. Reduction in funds would require reduction of services and programs provided by the organization. Overall, the analysis identifies 4 key areas that the organization should work on to ensure success: a clearly defined mission and vision, employee satisfaction and engagement, identifying a sustainability plan for programs, and building and strengthening community partnerships. Clarifying the mission and vision. A defined and refined vision and mission is beneficial both internally and externally. Both staff and community members will be able to better engage if they know the intention of the organization. A focused mission and vision will also allow the organization to identify scope of services, eliminating those that are unnecessary and allowing HCB to pour more energy into those that relate to the vision. Again, as mentioned, there is a great opportunity to conduct a needs assessment and focus group, gathering input from community members on their needs. If HCB is attempting to change the health behaviors of persons, people will be more likely to change the behaviors that they feel that they need to change themselves. Based on the feedback, the staff can present to the board a proposal for the revised vision that will be voted upon. Based on survey results and the recommendations of the HR director, it is proposed that HCB adapt an organizational culture that emphasizes a collaborative and cooperative model. This model will use strengths that HCB already possess, such as the friendliness amongst coworkers and open communication with supervisors. It will also address the areas that need improvement, such as feeling that HCB is not concerned about employee well-being and lack of direction in achieving the mission. By engaging mid-level managers in decision-making and their reports and responsibility sharing, as well as promoting transparency, employees will feel a sense of involvement and value, making each staff member more likely to engage and contribute to the mission and strategic plan of HCB. It has been recommended by the HR director that the executive leadership staff become more visible. This can be achieved by having open office hours once a month where employees, if they choose, can approach a leadership member and discuss any ideas or concerns that they have about the organization. The sustainability of programs is important both internally and externally. Once a mission and vision is agreed upon, programs and services that do not relate to the mission should be eliminated, allowing HCB to focus funding on less programs once grants run out. It will also be important that HCB work with the quality improvement staff to maintain county contracts by becoming accredited with the Public Health Board. As of now, it is the mission and vision of Healthy Community Brookfield to have a healthier community through health promotion and wellness services. Healthy Brookfield community cannot change the health and status of a county without the partnerships and collaborations of organizations that share the same vision, as needs of the communities are great and resources of organizations are limited. To establish stronger partnerships, organizations must know the mission of HCB, requiring again that HCB refine the mission and clearly communicate it to the community. Once organizations are aware of the mission, organizations which share the same vision for the community will be more eager to collaborate. It is recommended that HCB begins and continues to coordinate with organizations that share the same vision to exchange information and communicate about how activities can be synced and eventually resources shared. In any case where another organization is providing services that HCB relies on grants to sustain, HCB should work to collaborate to support the other organization in continuing to provide these services, rather than duplicating them. Costs and resources associated with these recommendations are minimal. The plan generally requires a change in communication, which will require staff hours. Once implemented, the plan should reduce overall costs by eliminating programs and the spending associated with them. There is potential to use outside consultants if needed, but it will not be likely. To launch the plan, we will begin implementing our cooperative and collaborative employee engagement model by sharing the recommendations with other staff for feedback. Next, the executive leadership team will meet to prioritize objectives and set a timeline to meet each objective. This new plan, including deadlines, will be presented to the board, and once approved, the plan will be implemented. Once implemented, the progress will be monitored and reported to staff and board members. At this time, I would like to thank you for your attention and open the floor for any questions and/or comments that you may have.